So like Kit said, I'm the manager of the Vaccine Preventable Disease Program. I've been with the health unit now for 19 years and just want to give a bit of an overview of the program. And then at any point in time, we can stop if there's any questions or just have questions at the end. I just can't see hands right now. So if anybody has any questions, feel free to jump in. So I thought today we could go over a little bit, I'll introduce you to our team, talk a little bit about our program work post-pandemic and what we've done for some of our catch-up and recovery plans, and then have some current stats as well as our current status as to what we are undertaking right now. So here is a picture of all of the staff that work on our VPD team. In this picture, we have PHNs, program assistants, there is a contract immunizer, our health promoter, and then there are other staff that actually belong to other managers, but who have a really large vaccine preventable disease role in their community. So it's quite a big team around the region. We'll talk a little bit and I'll show you a little bit about the work that we've done with children in schools, daycare facilities. We've had a lot of work with community partners. We've collaborated in clinics with community partners. We reach out for education during our annual fridge inspections. We do provide education and just have a lot of one-on-one phone call conversations to discuss immunizations. We also deal quite a bit with vaccine storage and handling, adverse events, as well as the various clinics that we hold throughout the communities. So I just wanted to share a few pictures of our vaccine depot. In the last year, we've had a pretty significant renovation to the depot, which was well needed. So in these pictures are our 3 fridges on the left that we had previously. The middle slide shows the additional double-sided fridge that we added. All of our storage containers are transportation coolers. And then the picture on the right are the 2 freezers that we had to acquire throughout COVID for the COVID vaccine. So if you ever are in Kenora and get a chance to, we'd definitely be happy to give you a little tour of the depot. Adverse events. So this actually we really encourage, and it's a requirement that people report any adverse events after somebody has an immunization. And it's a really important step to ensure the safety of our vaccines. And that happens nationwide. So in 2022, we had a total of 70 adverse events that we reported through our CCM database, and that was mainly COVID vaccine, so not unexpected. And then 9 into the database that we referred to as IFAS, which no longer holds any of the adverse events. They all transitioned into the CCM database. So far this year, we're sitting at 30 adverse reports, but we do expect as we get into the high season of flu and COVID that we will start to see an increase in those. Last year, we did a lot of work to catch up all of our students in the schools who we hadn't been able to get into throughout the pandemic. And as well, the year before the pandemic started, there was also a school strike. And so there was times where we couldn't get into a lot of the schools as well. So the amount of work that we had did compound, and we kind of made a plan last year to fit in where we could between COVID clinics. So in the fall, We did actually get into the schools to provide the grade 7 vaccines. January to March, we were in elementary schools, and we actually went in 2 to 3 times for almost every school, calls and reminders, because it was the first time we knew we were going to initiate the ISPA assessment process or the suspension process. So we wanted to make sure that we provided a lot of opportunities to try to get everybody caught up before that happened. We did initiate the suspension process in May, and then we went back into the high schools and provided booster shots, did some more grade 7 vaccines. And those grade 7 vaccines were offered to everybody, grade 7 through grade 12. This year, we still have a little bit of recovery work to do, but I'll show you later. We did really well in our catch-up. So it's starting to feel like a more routine or regular school year. So we have gone in to the schools in September. We just finished that probably the week before the COVID clinic started. We are quite busy right now with COVID and flu clinics. December, we've kind of left open to either keep going with the COVID and flu clinics or start to look at if there's any catch-up work that needs to be done from those grade 7 clinics and plan for the school clinics that you see listed there for January and February. We're going to go into the high schools and try to do an ISPA suspension round. February, March, we go into the elementary schools, and then April and May, we're going to definitely do the second round for the grade 7 vaccines and kind of have a look to see where we are at and decide whether or not we should initiate another assessment round. So that's the plan for the school year so far. And we're really hoping that we will be able to get into all the schools and actually continue with that work. So I'm going to switch gears a little bit. Hopefully this is big enough for people to see. These are the COVID stats from the beginning of time until as of April 13th of 2023. And the sections that I've highlighted are the sections where the health unit staff provided the most input into the COVID vaccines. So you can see 49.1% of the mass immunization clinics we were a part of. We were also part of the mobile delivery sites, which are at 25.5%. We played a role in the school clinics below. And because all of these events are listed in the database COVAX, if anybody that was from the health unit that was setting up a clinic listed it as, say, a pop-up clinic or a mobile team homebound patient clinic, we could actually be part of that. So the 49.1% is really the bottom amount of work that we put into those COVID vaccines. And if you look at it in comparison to the rest of the province, the health units did 43.6% in mass immunization clinics, but many of them, like the pharmacies in Ontario, were at 28.9%. We were only at 9%. So we did do a lot, percentage-wise, we did a higher percentage than other health units in the province. So I just thought I'd like to capture that. Flu vaccines. So the first table here is 2021 to 2022. We had close to 4,000 flu shots, which is average for us in all of the years prior to that. Well, in 2022, the number of flu shots we gave doubled, more than doubled, to 8,380. And most of that was a result of fewer pharmacies and primary care facilities providing both flu and COVID. So people just really wanted to go to the one place where they could get both vaccines at the same time. Um, and so therefore we were seeing a lot more people. And then the bottom chart is really just a breakdown of the work for around flu shots that the Northwestern Health Unit provides in comparison to the rest of the province. So in comparison to the province, Ontario health units do 3%, 3.83% of flu shots. And the majority of flu shots in Ontario are done in pharmacies and physician offices, where that is not the case in our region. So we are seeing a lot more people for flu vaccine. And this is just a quick snapshot of what we've done in the last couple of weeks at our clinics. We're just around 2,000 flu shots and a little over 2,700 COVID vaccines. I actually thought that was a little bit, I kept checking with people because I found it unusual that we would be giving more COVID vaccine than flu right now. But I think what's happening that there's a lot of pharmacies in our region that are only giving flu vaccines. So people have booked at pharmacies, they've gone for their flu, but then they're coming to see us for COVID vaccine. So it's been a busy couple of weeks, and I know people are busy this week and next. So we'll keep track of where we are at so we can provide another fulsome report of our COVID and flu shots this fall season. This is a really complicated chart, but I'll try to just summarize it up. This is showing the work that we've done in the school settings throughout the catch-up campaign. So in October of 2022, when we started out, and I'm hoping you guys can see my cursor, but you might not be able to. Let's see if I can do this. No, sorry. October of 2022, from the JK to grade 7 birth years, we had 84% of our kids were up to date, meaning that they were not overdue. But we really want, these are mandatory vaccines, and we really want people as close to 100% as we can get, knowing that we'll never reach 100% due to medical and philosophical exemptions that may be in place. It sounds like a high number, but really when you look at it over here, there's 853 students that were overdue for vaccines, and that's just overdue, meaning that they should have had it a while ago. And when we look at the number of students who are actually due for vaccines, that bumped up to over 1,000. And when we look at the high school grades, we were sitting at 64%, and by the end of June, we're able to get up to 85%. So it's quite a lot of students. The staff did a tremendous amount of work to bump up our percentages so much. Just in that 1 year alone, we were actually thinking it would be a 2 to 3 year process to get caught up at least. And they made tremendous strides in just 1 year, so it was amazing. The bottom half of the chart, sorry, is just showing where we are for the grade 7 vaccines. And we're just looking at the students that were in grades 7 through 12. So for Hep B, we went from 45% up to 51%. The HPV virus, vaccine, we went from 41% up to almost 50, which is great. And the meningitis vaccine, that is one of the mandatory vaccines, jumped from 65% all the way up to 87%. And I just wanted to throw in the number of students because the volume is quite remarkable. So for meningitis, just as an example on the bottom, they started out with 1,521 students who were eligible to receive that vaccine and were able to, in a year, bring it down to 547. So really remarkable work and a lot of work that they put into that, considering that they were still doing COVID vaccine in between all of their trips to the school. And this is where we're starting off with this year. So for our JK students to grade 7, we're sitting at 93.53%. A lot of that has to do with new students coming in JK who are due for vaccine. We potentially could have students that were up to date but have now become due for vaccine just since June. And then in the high school grades, we chose grade 8 to grade 12. We're sitting at 82.28%, and we have close to 700 students that would be eligible for vaccines in that category. And these are the grade 7 stats prior to us going in at the end of September. We were at 72% for meningitis and 46 and 44%. So I know the staff were able to immunize roughly 400 to 470 students in the 2 weeks that they were in the school. So we'll be looking to see by the end of December if we can get back into the schools, how well we have caught people up. We still have people calling and coming into our offices on the days that we're holding family clinics in office.